safe, and especially to keep those most vulnerable safe. As I mentioned yesterday, today our health authorities are focusing on those areas where there has been outbreaks or clusters and ensuring there is more testing done in those areas. I'm also pleased to say that in New South Wales we've done in excess of 103,000 tests now, and that's a good thing, because the more you test, the more you can identify and the more you can exclude people who don't have it, but more importantly you can isolate those that do and make sure their contacts are also on high alert. And this is a good thing, and we'll continue that testing regime. It's one of the things that's allowed us to make sure we try and contain the spread as much as we can, and that's critical. We also appreciate that, given what's occurred around the world, that the supply of medical equipment isn't what it used to be. New South Wales relied on many different sources of equipment, including many sources from overseas, which no longer exist or have been massively disrupted. And so today, I'm calling on the great people of our state, those great business people, those manufacturers who are able to retool, to consider retooling, to help supply those additional things we'll need in coming months, whether it's sanitisation, whether it's medical equipment, and a whole host of other things which our hospitals will rely on in the coming months. And we say this because we have confidence in the people of this state. We know already that many companies have started retooling. Many companies that used to construct other things are now building bottles or actually converting their product to sanitisers. So we know that's already occurring, but today we formally start the process. And this morning, businesses can log on, or any individual who need support in retooling or would like to explain what they're doing in retooling can simply go onto newsouthwales.gov.au, and there's a special portal for them with information on the types of products we'd like to see manufactured in New South Wales, the types of jobs we'd like to see created in New South Wales, and how we can support them in doing that. So again, if you go to newsouthwales.gov.au, you're a business person or a manufacturer or someone who has some intelligence on what we might be able to do in New South Wales, you can do it through that portal. But again today, my message is to thank everybody for their cooperation, to thank everybody and appreciate the frustration everyone's going through, but also say to everybody, we're deeply grateful for the cooperation, but we have to remain vigilant. Do not look at the number of cases and whether they're up or down on a day, because it doesn't take long, it doesn't take much for things to get out of control. At this stage, we are still to an extent controlling the spread, containing the spread, but we know we can't do that forever, because this virus is virulent. It spreads really, really quickly and very unfortunately too effectively. And therefore we have to maintain our vigilance. We can't let our foot off the pedal, we can't relax, and I know that's a difficult thing to say when so many families now are struggling with the new arrangements and adjusting their own lives, and we're grateful for that. But the important thing to remember is that we're all in this together. All of us are having to adjust, all of us are having to do things in a different way, but it's to keep everybody safe. What I intend to do now is ask Commissioner Fuller to give an update on the issues he's responsible for. Then Dr McAnulty will give us an update on the cases and the situation in New South Wales, and then I'll ask Minister Ayres to explain a bit about the retooling efforts and initiative we're launching today. Thank you.
Good morning. Thanks, Premier. Acknowledged Minister Ayres, Dr McNulty. Good morning. The airport operation continues. We've seen some 3,000 Australians repatriated into New South Wales, and they are currently in hotels in isolation. We've got approximately another 700 people coming in today. I spent most of yesterday reviewing our processes around health, welfare and security, and over the next 24 hours we will certainly improve those. I know there's people who are posting on social media their dissatisfaction. Look, some complaints are reasonable and we'll deal with those, and there's lots of other people that are behaving well and they're just glad to be home in Sydney. So, we shouldn't frame everyone in these hotels as people who are ungrateful, because that's certainly not the case. And every day we get through, then they're a day closer in terms of going home, which I think is a wonderful outcome for everyone. In terms of the police operation on the ground, police are still responding to calls for service like they did pre-virus and doing an outstanding job. We know 2 nights ago new powers were switched on in terms of an escalation, seeing people self-isolate, etc. And we know what this is for. It's for our safety, the safety of our families and our neighbours. Police have been out enforcing these laws, and I know there has been some criticism of police, which I don't accept. I accept the criticism of my leadership, certainly. We continue to re-educate our force almost daily in terms of changes around powers and policy. We haven't issued one infringement for the new powers at this stage. I've asked police to show a high level of discretion. I've mentioned this yesterday and the day before. Our power of discretion is one of our most powerful powers, and we'll continue to use that. I'm not suggesting we won't write a ticket to someone or a business owner. Self-isolation is still important for all those that return from overseas pre-Saturday night, and we issued a ticket to someone for that yesterday. But again, I would ask that the community continues to work with us. We understand these changes can be difficult, particularly with our culture, to readily get, and we'll continue to work and give you our best advice and guidance. I know there will always be what-ifs that will be challenging, but the message is simply around small numbers are safe, which is to stay home when you can. If you need to go to work, please continue to work. It is so important for our economy long term. If you need medical assistance, pharmacies, doctors, your hospital, you can leave. If you need food, you can leave. If you're driving home and you need a takeaway coffee, there's nothing wrong jumping out the car and grabbing a coffee. Just don't sit down and have it there. And I'm sure most people aren't doing this in a malicious way. It's just our lifestyle. But we need to continue to be reminded that what is safe is being at home at the moment unless you have to work. Thank you.
Good morning. I'm Dr. Jeremy McAnulty from New South Wales Health. I'd like to give you an update on the numbers. So to date, at 8 o'clock last night, we've had 2,182 confirmed cases in New South Wales. This includes 150 new cases confirmed yesterday. In total, we've tested 103,361 people and have been excluded. And sadly, there have been 9 deaths. There's a new death reported yesterday, sadly, in a 95-year-old woman from the Dorothy Henderson Lodge, where a number of cases have been reported previously. And we're pleased to see that the additional testing has been, as recommended yesterday by Dr. Chant, is occurring among GPs, but also with a pop-up clinic at Bondi beginning today. Thank you.
Today we're sending a call to arms to all New South Wales businesses, manufacturers and suppliers to say that we need your help to get through what New South Wales is suffering from. We have 8 products that we know are in high demand and will stay in high demand for the foreseeable future because of either complete shutdowns of supply chains or heavily disrupted supply chains. They're things like hand sanitizer, hand soaps, disinfectant and cleaning products, masks, eyewear, toilet paper and other paper-based products. Today, businesses will be able to go to newsouthwales.gov.au and be able to register their capacity to supply these products with the New South Wales Government. It allows us to be able to tap into your supply chains. It allows us to be able to tap into your innovation. And we're also asking on manufacturers right across New South Wales, if you have the capacity to retool your factories, your shops and your workforce to provide the things that we need, we will be your customer for the foreseeable future and we will be able to buy from you with confidence. You'll be able to log on to our website, identify the products that you can help us with, and we'll be able to get in contact with you straight away. You can also contact the COVID-19 hotline on 13 77 88 and be able to register your interest that way if you're not able to access the internet.
Premier, have we gone too far with these new laws? Are we now living in a police state?
Look, I appreciate that this is a massive change in lifestyle for all of us, but it's to keep us safe. And we've learned from the experience of other countries. We've seen what's occurred there when countries haven't responded early enough to this virus. We don't want to see people unnecessarily die, especially the most vulnerable, because the virus is spreading too quickly in our society. This is about controlling the spread as much as we can. We can't stop it. You can't stop this spread, and I want to make that very clear. This is not something you can stop, but it's something you can try and control, and that's what exactly we're trying to do. And we're finding the right balance to make sure people can still leave the home when they need to work, or when they need to study, or when they need to access supplies they need, or for medical attention. We appreciate that for some people this is a huge change in the way they live, and I accept that. But, you know, I said at the beginning when the virus took hold in New South Wales that we wanted a no regrets policy. We wanted a policy where we could all look back and say, gee, I'm glad we did that at that time. Because things are, unfortunately, from a medical perspective, going to get worse. We are going to see more cases, we're going to see more people need hospitals, and we need to make sure our hospitals are ready. We need to make sure we have everything we need to take care of the number of people we anticipate may get sick. And I know there's various modelling which has been discussed and talked about, but what we're hoping to do is make sure that we contain the spread as much as we can, reduce the number of people that need hospital at the one time, so that we can take care of everybody in the way that you'd expect.
Premier, the laws are highly confusing for people. You must admit that. Is a pregnant woman allowed to sit on a bench in a park with no one else around her in the sun? She just wants to get out of her house.
Well, look, there's no doubt.
Yesterday, the police were moving.
Yeah, look, there's no doubt that there's always grey, but I'm pretty sure that most people are pretty clear on what they can do. You can leave home if you're going to work or study. If you're going to get...
In that instance, is a pregnant woman
Well,
obviously, no one else around?
what we're asking people to do, especially vulnerable people, is to move through. You shouldn't really be stationary anywhere. You shouldn't really be sitting anywhere, especially if 50 people might be socially distancing. But if they're all gathering in the same park, that's not acceptable. And that's why police have had to act. And I appreciate the Commissioner's comments, but I also want to say this to the broader community. The police are only there to keep us safe. They don't mean to be overly zealous in their enforcement.
And yesterday was overly zealous?
No, I think yesterday was a huge shock for everybody to come to terms with the new laws, with a new way of living for us. And I appreciate some people unexpectedly were asked to change their behaviour, and you know, that is not intended for anybody to feel uncomfortable or anything like that. But this is just about police making sure, because unintentionally, if people do the wrong thing, and everyone's intention might be good, but if unintentionally there's too many people in a particular area, that will spread the virus. And as I said, for most of us it won't matter, but for those most vulnerable, it is lethal, absolutely lethal.
Premier, why was it that at 10:30 at night on Monday night that this...
I'm sorry, he started first and then I'll go to your question. Yeah.
Is this the new normal, police driving through parks that move people on that are sitting on the ground? Is this the new normal?
Well, look, you know, the advice is that you should be walking through, you shouldn't be stationary at those locations, because if a number of people decide to be stationary, that's an unsafe place. So we're saying to people, exercise, but walk through. Don't stop and stay at a location. As you know, that's why we've said gatherings of no more than 2. Right? That's why we put the rule in place, gatherings of no more than 2, because you might be socially distancing from one another, but if you have too many people at the one location, that is a risk. It's a health risk. And I appreciate for some people this seems onerous, but this is to keep our community safe, and it's again part of our no regrets policy. We don't want to look back at this time and think, why didn't we do this earlier? Why didn't we try and stop the spread earlier? And that's what this is about. And I appreciate for some people it's a huge adjustment, and even for our police are just trying to do their jobs. Our police are just on the front line trying to keep us safe and trying to do their jobs. And if occasionally, you know, people feel that they've perhaps been asked to do something they don't want to do or shouldn't do, please also know that police are just there trying to do their jobs as well. This is difficult for everybody. And we've obviously, it's a huge change, and that's why I'm hoping that yesterday, today and the next few days, people will absorb the change, whether you're a frontline police officer or whether you're someone like all of us who have had to adjust to their lives massively, that all of us absorb the changes, adjust to see how we can make the best of them. And I know that after the initial shock has perhaps subsided, that people will think of innovative ways in which they can manage their lives, manage their families, but also stay safe. And I know this is difficult for many, including myself. We've all had to adjust. But this is really about keeping everybody safe. And as I said, especially those most vulnerable, because it might be okay for me and all of us standing around here, but for those most vulnerable, we don't want to see them suffer or worse, die, because we haven't done everything we can to make sure we protect them.
The intention's entirely legitimate.
Oh, sorry, you were next.
So
and then I'll come to you.
The intention obviously is legitimate, but there's clearly community confusion. So why was it given the changes were made after 10 o'clock on Monday night, and then yesterday there was no formal announcement? We didn't receive a press release. The health minister who signed off is not here today to actually explain to the public what happened. It seems a little sneaky.
Well, no, I explained it at 8 o'clock yesterday, and the Prime Minister explained it the night before. We've been very public about this, and it's been on our website. We've used many, many channels, and I want to reiterate again, it's okay to leave home if you need to work or go to school. It's okay to leave home if you need medical attention or care for someone. It's okay to leave home if you're exercising. But please make sure, and of course it's okay to leave home if you're getting food or other essentials. But beyond that, we don't want people to move around. Restricting movement will stop the spread. This is about stopping the spread. Restricting movement, restricting interaction stops the spread, and that's what this is about. It's about stopping the spread. And can I say, perhaps too much. I've been out talking every day to make sure people appreciate the changes, but it's still early days. We only brought them in a day ago, and I appreciate people. It's still sinking in for a lot of people, but please know that you can look on our various websites available. You can ring up, you can speak to somebody, you can look at various outlets of information, and I appreciate for many people it's a huge adjustment. But I also know that it's also making people feel a bit safer knowing that government's doing everything we can to send strong messages to the community, to give advice. People are looking for advice, people want to do the right thing, and it's only always a small minority that choose to ignore, but that unfortunately in a situation like this, a small minority can lead to literally hundreds of thousands of deaths.
Premier,
Sorry, she was next, and then back to you. Yeah, I'll get Dr McAnulty to talk about that. But as we said yesterday, if there are areas where we know there's higher transmission than others, we will consider local initiatives, and in this instance, massive testing in those areas. But I'll ask Dr McAnulty to provide at least the health advice on that. Yeah.
is it ready to go already?
My understanding it's opening today, and it will be open 7 days a week. The strategy is to make sure we've got good testing out there, particularly in groups where we're seeing local transmission, and Bondi is one of those places we're seeing local transmission, and we've seen cases among backpackers in recent days, particularly related to parties and so on. So the new measures, social measures about not congregating, will be really helpful in preventing ongoing transmission in that community. But we want to make sure that we've got good testing by GPs, by COVID clinics, and by this new pop-up clinic operated by St Vincent's Network, which will give access to people for testing. So we've also broadened the guidelines, as Dr Chant mentioned yesterday, to encourage where a doctor has clinical suspicion after taking a good history that the person might have COVID to do testing. So we don't want to miss cases. Again, the strategy is to find people who are infected early, so that they can be put in isolation and cared for, and to make sure we trace their contacts so that they can be identified and put in quarantine until they're out of the danger period.
Commissioner, can I ask, you know better than anyone that a good police force has a community coming with them. Do you think yesterday's actions undermined that?
Look, I think I know I've thought a lot about it. I've seen the vision myself, and I know the challenges better than anyone in terms of policing and the importance of keeping the community and police close. On one hand, could they got out of the car and achieved the same thing in a I guess, a less aggressive way that was shown? I mean, yes, they could. No, I haven't, and we will continue to communicate, because it's 17,000 police. It's not just the 4 in the car. But then on the other hand, there's tens of thousands of parks we've got to get to at the same time, and we're the lead enforcement agency for this. So, is that the sort of policing practices that we want to see in New South Wales? No, it's not. And again, I can only say that police do have a wonderful relationship with New South Wales. We will be glad to see the powers go when the virus has reached the point where we can get back to some sense of normality. And again, no one was issued a fine, which I think is important in terms of showing that we do get the uncertainty in relation to it. And I understand that there will be other days where people will feel aggrieved in terms of police enforcement, and I've got to deal with those. I've got to look at it. I talk to the Health Minister a number of times a day. Has the legislation been framed well, and can it be policed? Because if it can't be policed, then it's not good legislation.
Does it have a sunset clause? Do we have an end point to this? Is there a 6-month date, a 1-month date? How does it work?
No, there's not. But really the Health Minister can turn that off or alter that at any time by signing a document very, very quickly. And if I think it's unworkable, I think if a couple of days' time we're seeing that sort of footage that's difficult to enforce, I would go to the Premier and say, we need to make some sensible changes to not erode public safety around the message on isolation, but to make it enforceable. But we're 2 nights in, yeah? No tickets issued. Some footage that was probably a bit disappointing and confronting, with people laying down, sunbaking. But again, if he's back sunbaking today, then maybe he's not getting the message as well. And there's a debate, if you're a pregnant woman, do you want to be out at the moment? I know you've got, the mental health issue is a big one. Can you sit on your balcony in the sun? And these are sort of debates that we have to have, otherwise people in New South Wales won't change behaviour. But I accept the criticism.
But Commissioner, we can have debates about it, but yesterday you were standing here saying you're going to come down with the full force of the law. Like
No.
If you're threatening people with fines...
No. So that was my statement last week over self-isolation, right? I do said that we are getting fed up when it came to self-isolation and for those who have had the virus who are leaving their home. Yesterday I used the word discretion 100 times. 100 times I said discretion is our most powerful power in fairness. At some stage, either this is workable legislation, and if it is, then people are going to start getting tickets. It's so early in the piece. We get feedback from the officers after every shift. Obviously, the footage is important for us to critically analyse that. We look at the training packages we're putting out to the 17,000 workforce. My messaging is to my workforce around discretion, and every day this is going to be a discussion for us every day. Yeah.
You said that you were pretty done with caution. You said that a couple of days ago. So,
yep.
I mean, at what point are the cops, your officers, going to start slapping people with fines and not caution?
Yeah, and I think it again comes down to the individual officer and the individual situation. Again, Coogee Beach was mentioned, the Public Audit Riot Squad, groups of people there. If we go back another day, then another day, I mean, at some point in time it's going to be reasonable. I think the community will say it's reasonable that we give someone a ticket.
Commissioner, what's the current situation with cruise ships, and is the Navy, should they be now involved? Are they ready?
No, the Navy shouldn't be involved. We're having really good conversations with the owners of these ships. There's 3 different sort of principal parties. The Sun Princess left White Bay last night, and it's on its way north out of New South Wales waters. It's a good resolution. We're working with 5 other cruise ships for a sensible resolution. We have taken more Australians off these ships since we met yesterday morning. We have done another couple of medical evacuations based on advice from doctors. We will continue to take people off who are sick and need treatment, or are pregnant, or are Australians, and that will continue.
Commissioner, the celebrity solstice.
The
celebrity solstice is docked in Port Kembla at the moment. What's happening there, and how many people are coming off it?
Yeah, again, there's still 9 ships. So I don't know the exact numbers, but you're talking thousands of crew members on these ships at the moment.
But how many are coming off? Like, how many did we see come off the ships last night?
Look, there would have been less than 10 collectively come off for either medical reasons, repatriating Australians, or someone was pregnant, and I felt that it was sensible to bring them back. Sorry, can I go to Chris?
And New South Wales will continue to fulfil its obligations under the law of the sea.
Yeah, absolutely.
Look after people.
Yeah, absolutely. But I think there's a big difference to opening up, 5,000 to 10,000 people into our hospital system that we've been trying to protect, that people have made big sacrifices for. People have lost their jobs protecting the spread of the virus. The health system is ramped up. It's all about protecting those ICU beds with ventilators for the New South Wales people. I've got to strike a balance there, Chris. It's not an easy one. I'm dealing with each of these matters personally. I'm taking that seriously.
Just for families, Commissioner, there's some confusion too. So a lot of kids are home, right, for a long period of time at the moment.
And mine.
Are you allowed to take your kids to the park and sit down and let them play around? Is that classified as exercise? Look, like we saw at Rush Cutters when they get moved on?
To be honest with you, my wife took the girls to the park yesterday with the dog. They kicked the ball for half an hour. They came home. Yep. They didn't sit around. Now, I'm not splitting hairs on it, to be honest with you, but it gets back to the Premier's message. If you need exercise, if you needed to go for a walk, go for the walk, get your coffee, go home. I honestly just feel as though it's our culture. It's just in our nature to go to the park and lay down and have a chat, go to the beach, have a swim. We're trying to make a big change in terms of our culture here, and I know it's not easy. And people text me every day the what ifs and can I do this and can I do that, and I know it's challenging.
Have you told the Federal Health Department or any authorities that it's not possible for your officers to lock down certain parts of Sydney?
There is no lockdown other than those people who are returning from...
It's hypothetical, because I know that they were talking about potentially clusters in certain parts of Sydney. Have you expressed the fact that you don't think it's practical for that to occur, say, cordoning off Bondi or cordoning off North Ryde?
We can surge within ourselves. We're a big force. Obviously, if that was a long-term or there were multiple locations, we would seek assistance from Defence in relation to that, and I've been given an undertaking from Defence that they would continue not just to support us, and they supported us through the bushfires, doing a whole range of activities, but we would have to look at a surge capacity at some stage. But there's no suggestion that we're moving to that.
Premier,
Can
in
you
regards to schools,
get some clarity on a question of...
Sorry, was that to me? Or to
Oh,
sorry,
was it Commissioner or you come in? Or did it...
You have
No, I think he had one for me, yeah.
There's been some confusion about seeing your family, right? Now, if your partner, boyfriend, girlfriend, whatever, is not living with you, you go to their house?
I would
see
put
them?
that under care, absolutely, right? Mental health, we get it, that's under care, absolutely under care, yeah?
Premier, in regards
Yeah,
to schools,
I really do. I think, we need to look after each other, but don't take the whole family with you. Don't take your grandparents. You know what I mean? Like, I understand, again, there's lots of good questions, but we've got to care for each other at the same time as well.
Premier, just in regards to schools, that there are numerous reports in both the major papers today and probably anecdotally as well, that a lot of parents are really starting to struggle working from home and to juggle with responsibilities with children, have written to principals. Is there too much expectation from principals and schools on parents at the moment?
Look, can I firstly thank all of our school communities. I want to thank teachers, students, parents, principals. The cooperation the school communities have shown has been outstanding. And I appreciate that many households are going under the pressure, but that's why we made the decision when we did to encourage parents to keep their children at home, so that we could set up the systems so that if we are in this situation for a prolonged period, that we can support families at home as much as possible. So what's happened in the last few weeks is that we've tested the systems in terms of online learning, in terms of information that's actually physically sent home with children, in terms of web-based material, and we've made adjustments accordingly. But I'm incredibly pleased also. We have less than around between 5 and 8% of students at school still, and that's important because for some students they don't have any other options, parents have no other options, and I want to thank again the teachers for making sure that happens. So we are seeing learning environments change, we are seeing the way children are taught changed, but we're also seeing phenomenal cooperation and good results. It has meant sometimes that parents or the people in the household have had to be a bit more hands-on in the learning experience, but we're hoping that as time goes on and the systems get better. Remember, converting an entire system, a learning system, one of the largest education systems in the world, to a largely online presence is a big task, and that's why I've really appreciated everybody's cooperation and patience over the last few weeks, and I'm sure everybody will take a breather when Easter holidays come round in a couple of weeks or end of next week, and people will take a breather and be able to relax a little, but at least during this time we've been able to stand up the systems as much as possible. And I know you're always going to have people that say they don't like something or don't like the way something's being done, and I appreciate that. But we always made a decision for the vast majority what would be in the best interests of our school communities, of our broader population, and also for our teachers, and I want to thank them. Some of my best friends are school teachers, and they've shared with me their experience of teaching children either from the classroom or through other measures, and it's been a wonderful experience actually to see people step up. And I just say, please think about our frontline workers, our teachers, our police. Everyone's just trying to do the right thing. We know this is difficult, it's difficult for everybody, but in the main, I'm incredibly proud of our citizens. And we also have to think about the other frontline workers, people driving trucks who are getting food to our supermarkets, our nurses, our doctors, everybody on the front line doing their bit. But in the main, given your question was about schools, I just want to thank the school community. I actually want to thank all the stakeholders in the school sector, whether it's public schools, independent, Catholic, Teachers Federation. Everybody has come together, and we're in a good place with our schools. Schools are open for those who need them, but the vast majority of people are learning from home, and the systems are now in place so that when we come back after the school holidays, there's as much structure as possible for children, because structure and routine will be incredibly important for households, and some households are making those adjustments. They're working out what works best for them, and in some households, I know from friends, they've got two parents working from home and children trying to learn, so it is a juggle, but we'll get through it. We'll get through it because this is about keeping everybody safe, and whilst the most vulnerable are those who are more likely to succumb to this disease, we know it can affect everybody in every age group. So you might have, for whatever reason, low immunity, you might have an existing condition you don't know about. The disease can kill you, can kill any of us. None of us are immune from it, and that's why we need to do everything we can to keep people safe. And again, it's not about stopping it. We'll never stop this. It will never stop. This is about containing it, controlling it, reducing the number of people that are in the hospital system at the one time, and that's one thing I'm incredibly pleased about at this stage. Again, no reason for complacency, but relatively, given the number of people who've been tested and given the number of cases, we still have a relatively low number of people in our ICU beds. But that will change. I'm not saying it might change, it will change.
Premier, on the regulatory process, the
Yeah.
figures now show 10% of total national COVID-19 positives from the Princess, 25% of deaths. There's now more cases outside the state than inside. Do we owe our states and territories an apology?
Well, look, obviously all of us are upset about what's happened in a number of instances. But I can assure you now that all authorities are working together to make sure we keep the community safe. And no matter, we have to be very careful, no matter how anybody got the disease, and we know the vast majority of people, because I've seen and read things about numerous people who've acquired the disease overseas, can we say no matter where you acquired the disease, the vast majority are overseas. So most people who've got the disease now came from overseas, or the direct contacts of those people are the vast majority. No matter where you got the disease or how you got the disease, this is about taking care of one another. It's about protecting those people and making sure they're getting the medical attention. But I think what we need to do from now on is really assure the community that we are, I'm pleased to say today people think we're going too far, because I don't want people to say we're not doing enough. I'm pleased to say people are saying you're going too far, because that tells me we do have a no regrets policy. I'd be worried if the questions I was getting today were you're not doing enough, because that's the last thing I want to hear. I want us to look back on this time and say, yes, it was difficult. Yes, it was stressful for many people, but we got through it as best we could compared to other places on the planet. I said yesterday there's nowhere else I'd rather be than in Australia, than in New South Wales, and I mean that from the bottom of my heart, not just because I'm the Premier, but I honestly mean that. And it's up to all of us to make sure we clamp down on this disease, whether, unfortunately for even people, it's been what they thought was a happy occasion has turned into tragedy by so many people acquiring it at a gathering or at a holiday or wherever they were. The important thing moving forward is for everybody to appreciate that we're doing our best to reduce the spread. And I know the community is as well, and I'm deeply grateful for that.
Can I just ask about the manufacturing stuff? Do we make any PPE or surgical masks in New South Wales?
There are some grade masks that are available, but we want to be able to expand what is available.
When you say available, do we make them in New South Wales?
At certain grades. So the reason why we're out talking to business today is to be able to talk to them to say if you can retool to get to the health standards that are required, particularly for use in a medical facility. We also know that masks of slightly lower grades can be used by citizens as they make their way around the community underneath the conditions that have been put in place. So if there are manufacturing capabilities here in New South Wales that can be retooled to expand that, then they're the people that we want to talk to.
Are there? Do you know if we can do that? Do you have the capacity?
That's exactly why we're out talking today. We've got little doubt that there are manufacturers who exist in New South Wales who will be able to reshape their production lines to deliver the things that we need. So we want to have that conversation. We want to understand what your capability is. We want to match you up to the various parts of New South Wales Health so that we can get the products back out to our community.
It's fair to say if that doesn't happen, we're a chance of running out of PPE and surgical masks.
There's no doubt that there is significant constraints on supply chains right around the world. We've got good supplies coming in, and we are working with suppliers right around the world to ensure that we stay stocked. But this is the reason why we want to make sure that we've still got those supplies over the long run. We don't know how long this will go for, so we want to be able to make sure that if those supply chains continue to be constrained, we supplement those with good New South Wales businesses making it here in New South Wales.
So these companies
support
that
available if retooling is quite a costly exercise for these, especially small businesses.
Yeah, so this is the reason why we want to be able to talk to businesses who think they have the capacity. You've got the opportunity to provide that information to us over the phone, through our web portal. We'll be able to talk to you, and if there are small gaps that the government can play a role in helping, we definitely want to have that conversation.
Minister, should the Airbnbs be shut down as the Shoalhaven Mayor has called for?
So the advice is incredibly clear. You've heard the Premier, you've heard the Police Commissioner say it today. The only reasons why you should be leaving your home are for compassionate care, work, exercise, or being able to purchase essential items. That does not include travelling for Easter. It does not include going to a holiday home. It does not include going to an Airbnb. I'm the Tourism Minister. I spend most of my time encouraging people to get out and explore New South Wales. Today, I'm saying stay at home. Do not travel. The advice is explicitly clear. This Easter, you're staying at home. Call it a staycation if you want, but you cannot travel around New South
But
Wales.
if people are still doing it, should Airbnb be told to stop operations?
Well, those people are clearly in breach of the public health order. The opportunity for people to report that to police exists. The advice cannot be any clearer. You cannot travel around New South Wales. These orders are in place for the health of every single one of our citizens.
This is the PPE. Have you got a time frame on when we might run out? And does that include PPE for doctors and nurses and stuff?
So we're supplying from around the globe at the moment, so there isn't a time frame, but the longer we can extend the supply chains, the more product that we can put into it, obviously the better off we'll be. We want to supplement our existing supply chains with New South Wales capability and manufacturing expertise. That's why today is a call to arms to New South Wales businesses to get in the game, come and talk to us about what you can do, and we'll want to purchase off you.
On that PPE, can we ask Dr. McAnulty, should we be telling members of the public to be wearing masks and gloves? There's a lot of confusion from different medical experts on whether that is effective.
So there's not. We don't recommend that people wear masks except in special situations. So masks and personal protective equipment is important and crucial for healthcare workers looking after patients, or for patients who are symptomatic who need to go and see their doctor. Is the time they should be wearing a mask before so that it's protecting the healthcare workers themselves.
Is one of the reasons we're telling people not to wear masks because we're running out of them for those vital healthcare workers?
Well, there's a number of reasons. One is they're not particularly effective if you're just wearing them around the community. And because masks is one place you get exposed to the virus, they can also go in your eyes and so on. So it gives a false sense of security. You need to be wearing masks properly to be effective, and we do need to make sure that they're reserved for those who most need them.
Doctor, what does the modelling show in terms of peak infection and peak hospitalisation in New South Wales? There's been some studies floating around this week saying it could not be until October or even November. So look, there's a number of modelling done at the national level. There are expert modellers who are assisting the Australian Health Principal Protection Committee to look at the various scenarios, and the important thing about the modelling is that the strategies that we had in place about finding cases early, about contact tracing, quarantining people at risk such as travellers is really, and the social distancing measures we're talking about are crucial to protecting the community.
Thank you everybody, thank you.